For decades, controlling blood sugar has been considered one of the most important aspects of maintaining good health, especially for individuals with diabetes. Regular testing and strict management have been encouraged to prevent complications and ensure long-term well-being. However, new research suggests that for older adults, an intense focus on keeping blood sugar within traditionally recommended levels may not be as beneficial as previously thought. In fact, maintaining overly tight control over blood glucose can pose significant risks, and a more flexible approach could actually lead to a better quality of life. A1C tests, which measure average blood sugar levels over a 3-month period, have long been used as a benchmark for diabetes management. A normal level is considered below 5.7%, with prediabetes falling between 5.7% and 6.4%. However, experts now argue that these numbers may not be appropriate for older adults. As the body ages, its ability to regulate blood sugar changes, and strict control can sometimes do more harm than good. While keeping blood sugar too high is linked to complications such as nerve damage, kidney disease, and heart problems, keeping it too low, especially for seniors, can be equally, if not more, dangerous. Older adults with diabetes are at a higher risk of hypoglycemia, or low blood sugar, which occurs when levels drop below 70 milligrams per deciliter. Hypoglycemia can lead to a variety of serious health problems, including dizziness, confusion, falls, cognitive decline, and in severe cases, loss of consciousness or seizures. The risk is even greater for those who take insulin or other diabetes medications that lower blood sugar. For people in their 70s, 80s, or beyond, a fall caused by low blood sugar can have long-term consequences, potentially leading to broken bones, hospitalizations, and a decline in overall health. Experts in geriatric medicine emphasize that the focus for older adults should shift from strict glucose control to overall well-being. Research suggests that aiming for an A1C level between 7.5% and 8%, and even up to 9% in those with other medical conditions, may be a safer and more effective approach. The goal is not to eliminate blood sugar management entirely, but to adjust targets in a way that prioritizes safety, prevents dangerous blood sugar drops, and allows for a better quality of life. This shift in medical thinking represents a positive step forward for many older adults who may have spent years or even decades striving to maintain lower A1C levels. It offers a sense of relief, reducing the stress and anxiety that often come with rigid diabetes management. Instead of being preoccupied with constantly measuring and adjusting blood sugar, individuals can focus on overall health, including maintaining a balanced diet, staying active, and managing other conditions that often accompany aging. Adjusting to new guidelines can be challenging, especially for those who have followed strict diabetes management routines for years. Many patients and their families may find it confusing when medical recommendations change. However, these evolving guidelines reflect a growing understanding of how diabetes affects people differently at various stages of life. The goal is not to abandon good diabetes management, but to tailor it in a way that minimizes risks and enhances overall well-being. This new perspective encourages older adults to have open conversations with their doctors about their diabetes management plans. If a person has experienced frequent episodes of low blood sugar, it may be time to reconsider treatment strategies. Working with healthcare providers to adjust medication dosages, dietary habits, and monitoring routines can help ensure that diabetes is managed in a way that supports long-term health without unnecessary risks. The message from experts is clear. Older adults should not feel pressure to chase the same blood sugar targets that were recommended when they were younger. Instead, they should focus on maintaining a safe and sustainable balance. This shift in thinking acknowledges the unique challenges of aging and empowers individuals to manage their health in a way that prioritizes safety, independence, and overall quality of life.